Assalamu alaikum. I'm Khushbu. I'm a clinical physiotherapist. Today I'm going to talk about what is spine bifida occulta. Spine bifida occulta is the mildest type of spine bifida. It is sometimes also called as hidden spina bifida. There is a small gap in the spine but no opening or sac on the back. The spinal cord and the nerves usually are normal. Occulta does not usually cause any problem and most people are unaware they have it. In spine bifida occulta, the skin at the site of the lesion may be normal or it may have some hair growing from it. There may be a dimple in the skin or a birthmark. The incidence of spine bifida occulta is approximately 10% of the population, and most people are diagnosed incidentally from spinal X-ray. What are the symptoms of spine bifida occulta? Spine bifida occulta, it is the mildest form of spine bifida and rarely causes symptoms. Children diagnosed with spine bifida occulta might have a visible mark on their skin at the lower part of the back when they are born that appears as a lump or red or purple patch, which we called as hemangioma, a dark spot, birthmark, or a dimple. Symptoms of spine bifida occulta affect the function of specific parts of your body caused by damage to your nerves, that is neurological defect, which could include bowel or bladder problem, constipation, incontinence, back pain, muscle weakness, weakness in the legs, and scoliosis. But most children don't have experienced symptom of spine bifida occulta. These symptoms could worsen during late adolescence and adulthood as their spinal cord stretches. How is spina bifida occulta treated? Most cases of spine bifida occulta don't need treatment. If symptoms occur, treatment focuses on reducing the amount of tension on your spinal cord. Treatments could include surgery to close the gap between the vertebra of your backbone, physical or occupational therapy to improve muscle strength, using mobility equipments like a back brace, walker and wheelchair, taking medicine to treat bladder or bowel problem. So, how we can reduce the risk of spine bifida occulta? Since the cause of spine bifida occulta is unknown, you can't prevent the condition. If you plan to become pregnant, you can take steps to reduce your risk of having a children with spine bifida occulta by taking folic acid, taking to your healthcare provider, discuss the medication you currently take along with any vitamins or supplements. Certain medicines, especially medicine to treat epilepsy, can cause spine bifida occulta. Managing underlying conditions. If you have pre-existing diagnosis of diabetes or obesity, work with your healthcare provider to manage the condition before becoming pregnant. The next is getting a genetic test. If you have a history of genetic condition in your family, talk to your healthcare provider about genetic testing to understand your risk of having a child with a genetic condition. So next is management for spine bifida occulta. First is physiotherapy for spine bifida. Practicing functional activities such as sitting, transferring and walking, correcting posture in lying, sitting and standing, exercises that are fun and stimulating to maintain or improve muscle strength, stretching tight muscles to prevent development of contractures. Physical therapy involves exercises and other techniques to improve gait, muscle coordination and balance. It can also help maintain range of motion in joints, build strength in weak muscles and improve flexibility in stiff muscles.